Hello, I'm Maria Patel, Chief Data and Analytics Officer at HorizonCare. At HorizonCare, we're committed to delivering high-quality, preventative care to the communities we serve, guided by value-based models and patient-centered strategies. In this video, I'll walk you through how we're using Informatica's Cloud Data Governance and Catalog, CDGC, to improve the accuracy, consistency, and compliance of our healthcare data. Together with Databricks, we're building a scalable foundation for preventative care programs that support regulatory reporting, care gap detection, and measurable quality outcomes. Today, I'll walk through HorizonCare's approach to improving preventative and quality care using governed data. First, we'll start with an overview of preventative care in the healthcare insurance landscape. Then, I'll outline some of the key data challenges we've faced, particularly around care gaps, reporting consistency, and audit readiness. Next, we'll explore how HorizonCare is integrating claims, electronic medical records, and provider data using Informatica CDGC and Databricks. Finally, I'll wrap up with a summary and share what's ahead for our data-driven care initiatives. As the Chief Data and Analytics Officer at HorizonCare, I lead our efforts to improve preventative care outcomes and ensure compliance with the Affordable Care Act, or ACA, and Healthcare Effectiveness Data and Information Set, or HEDIS, reporting requirements. My team is responsible for connecting fragmented data across EMRs, lab systems, and claims platforms, and standardizing clinical metrics like A1C levels, immunization status, and physical exam history. Our ultimate goal is to enable timely, data-driven patient outreach while reducing the burden of manual reporting. And by using trusted, certified datasets, we make sure HorizonCare is audit-ready and equipped to support quality improvement initiatives across the organization. At HorizonCare, we've partnered with Infoverity and Informatica to simplify and streamline how we manage healthcare data. Infoverity brings deep experience in healthcare data governance and analytics strategy. Informatica provides powerful tools like Cloud Data Governance and Catalog that allow us to standardize, certify, and govern our clinical and claims data at scale. Together, this partnership is helping us make data more useful, more trusted, and ultimately more impactful for preventative care programs. Like many healthcare organizations, HorizonCare faced several data-related challenges. Our patient data was fragmented across EMRs, lab systems, and claims platforms, making it difficult to get a complete picture of care. We also lacked standardized definitions for key clinical attributes, such as blood pressure values or smoking status, which made reporting inconsistent. Much of our reporting process relied on manual review, driving up cost and time, especially for HEDIS and ACA compliance. And without clear data lineage, we struggled to demonstrate transparency during audits. That's why we've focused on accelerating innovation, building trusted data pipelines, identifying care gaps at scale, and delivering predictive insights to support population health. At HorizonCare, we knew that fragmented data was limiting our ability to deliver timely, preventative care. As I mentioned earlier, data from EMRs, lab systems, and claims repositories weren't connected, and clinical attributes like last physical exam date or smoking status were defined differently across systems. That made it hard to identify patients overdue for screenings and even harder to report accurately for ACA and HEDIS. To solve this, we used Informatica CDGC to define and catalog clinical terms, assign data domains, and apply quality rules. We also use CDMP to securely deliver certified data to our analytics teams. For example, we created a business term called Preventative Screening Due, traced its lineage, and used that definition to populate outreach lists and dashboards. This approach has helped us ensure data trust, reduce manual chart reviews, and improve coordination between teams across HorizonCare. Informatica's Cloud Data Governance and Catalog, CDGC, gives us the foundation to manage preventative care data at scale. The glossary allows us to define key healthcare terms, like preventive screening due or hemoglobin A1C result, in a consistent, governed way. The catalog helps us organize and locate trusted data across clinical, claims, and provider systems. With built-in data quality monitoring, we can automatically detect gaps and outdated values that impact compliance or care coordination. And AI governance gives us transparency and control over the advanced models we use to identify at-risk patients or predict care gaps. Together, these capabilities ensure our data is ready, not just for reporting but for meaningful action. Informatica's Intelligent Data Management Cloud, or IDMC, offers a full suite of tools that help HorizonCare prepare, govern, and protect our healthcare data. Cloud Data Governance and Catalog gives us trusted views of clinical and claims data, enabling better decisions and more consistent regulatory reporting. Cloud Data Marketplace helps us securely deliver those trusted datasets to the right users, using standardized access controls that reduce complexity and ensure consistency. And Cloud Data Access Management provides the protection layer, ensuring compliance with HIPAA and other privacy standards, while safeguarding member and provider data. Together, these capabilities make it easier for our technical and business teams to work with sensitive healthcare data in a secure, governed, and scalable way. At HorizonCare, once our preventative care data is standardized and certified through Informatica CDGC, we bring that data into the Databricks Lakehouse Platform to unlock powerful insights. Using Databricks, we ingest certified EMR and claims data via Delta pipelines. Apply ML models to detect care gaps and flag overdue patients. Build notebooks and dashboards to monitor HEDIS measures and provider trends. Empower population health teams with real-time insights. This end-to-end solution ensures our preventative care programs are not just compliant, but intelligent, scalable, and focused on measurable outcomes. Together with Informatica, Databricks helps us close gaps, reach patients sooner, and improve the quality of care across our entire network. Thanks for joining me on this overview of HorizonCare's preventative care journey. Up next, you'll see how we put this into action, starting with an overview of how CDGC supports preventative care and a demo of our glossary and quality rules in use. We'll then walk through the catalog and data lineage features, followed by how CDMP streamlines data access for healthcare analytics. You'll also see how CDMP empowers self-service for care teams and how CDAO enforces protected access to clinical data. And finally, we'll close with a look at how HorizonCare uses Databricks together with Informatica to drive scalable, intelligent analytics for population health.